Hello, Edgar. I am here today for sport.
I've been waiting for you. Good afternoon, my name is Brisa and Hernández, and I will be your doctor today. I'm one of the ophthalmologists here, by the way. Would you mind introducing yourself, please?
Hi, my name is Edgar, Martínez Sánchez, but people call me Moises.
Moises is a beautiful name. That's my father's name.
That's awesome. I should be friends with your father.
I know that will be awesome. Well, to start, we have a set time of 25 minutes in which we solve your condition, okay, for your community. The hospital only allows that time for each patient we see per day.
That's okay, I think this time is good.
First, I would like you to be relaxed and under pressure, and of course, I'll need to perform a physical examination during the consultation. What brings you here today, my friend?
These days I have worsened pain in my knee, which have had for about 2 months.
Okay, is there anything else you would like to discuss or review during the interview?
Yes, now that you mention it, I would like you to prescribe the pills I use it to my pain, and they call Guerrero.
Perfect. Then, today we will review your knee and see if it's necessary to administer another medication or some therapeutic method. Would you like to add anything else?
No, that's it.
Excellent, Mr. Moises. Let's start. Is it okay if we start focusing on your knee pain?
Yeah, it's okay.
Good. Could you, from the beginning, explain to me how do you think the knee pain progressed to this day, please?
Well, I have always been very athletic, so I love playing football and other sports in my free time. But progressively, I was peculiar pain in my right knee that was getting worse month after month. And however, about 2 months ago, and the pain has turned unbearable, and to even walk a little.
I see. Well, Mr. Moises, I'd like you to know about your symptoms specifically.
These days I never felt desesperated because the pain does not stop with the rest. And in addition, the pain causes me a lot of sweating with the redness in the knee. And these weeks I have been limping when walking, and then I cannot ever run.
So, you feel the pain in your right knee, and it's getting worse, right? Tell me more about the pain.
Well, I feel a pain that irritates my knee as my movement become more dynamic, especially when I walk down the stairs or try to run short or long distance. It feels to irritate to contiguous area but does not extend much. When I wear shoes, I feel that the pain get worse faster. That's why I prefer to wear tennis shoes. In the morning when I wake up, the pain does not appear until the afternoon. In fact, what I do to relax my knee, I place pillow in it.
Do you mention that pain has worsened for 2 months? Do you think that there is any factor that makes pain worse in your daily life?
As I say, I love sports. That's why I have not stopped playing or exercising despite the pain. And months ago, I started attending soccer games with my friends in the afternoon as a midfielder player, but these days my knee hurts 10 of 10.
How has this problem affected your life?
Well, I have not been able to meet my friends to play soccer anymore. I gained weight being not exercising properly. I have adopted a more sedentary life. It has personally affected me emotionally. I feel that it's not me. I have a distancing with my family because I can't be able to and have fun with them as before.
I know this is hard for you, Mr. Moises, but I'll do my best to help you. I promise. Do you consider that your athletic life has influenced your current illness?
Well, I think so. I have always practiced sports that involve a lot of running and using my knee. I think my body has taken the bill of all the stress I put to it.
Don't worry, you will be okay. Recapitulating, okay? You have had a very active athletic life, which has generated problems in your right knee. However, until just 2 months ago, it was when the pain began to worsen, reaching the degree to which you have almost total immobility and your personal life has been affected by this problem. In addition to your health, we will continue with the next step of your interview, if you are comfortable with it. I will start asking you a little more specific questions about this problem. Do you have any problem with that?
No, doctor.
Mr. Moises, how old are you?
I am 27 years old. Pastor Morris, my victim. You should join us. My wife makes an excellent friendship.
Thank you so much. Could you please talk about the onset of the disease?
Look, as I mentioned before, I had always had discomfort in my knee, but now interrupted my activities. But 2 months ago, with playing with my children in the garden, I got a terrible cramp that did not stop, so I had to lie down until my wife gave me a pill for the pain. And the next day I went to the doctor, who prescribed me ketorolac without ever getting my physical exam.
Okay. The doctor must perform a physical examination at a time for the wide range of complications that any problem can bring. I'm glad you came here today. Could you talk about the radiation of this pain?
I know. That's why now I put all my trust in you, doctor. I just want this pain to stop. Well, it has not spread to other areas that are around the knee. However, as I said, it's a desperate pain. It hurt so much.
So, could you use a scale 1 to 10 to indicate how much it hurts?
It's a terrible 10 of 10.
In your childhood or puberty, did you experience this type of pain?
No, I never felt something similar.
Has it changed since it appears?
Yes, it started very quiet and entertaining, but it became stronger if it burned my knee.
Any associated symptoms that you want to add?
I felt a little dizzy when the pain is unimaginable. In addition to redness and swelling. That's it.
How has this pain been progressive in your life? Would you define it chronic or current?
Yes, it has had a profound impact on my mind and daily life. I hope you can solve it quickly without having to go through the high risk surgery.
What is your main concern regarding your problem?
I am worried about the great impossibility that it will represent in my daily activities and my work due to the large number of hours in the work.
Where do you work?
I work in multiple offices as a supervisor, verifying that everything is in order. That's why I must stay active for many hours a day.
Have you previously had any disease of interest?
No, I have always been a very healthy person without any type of hospitalization, surgery, or any injury of interest, despite my love of sports. I considered myself very lucky until my knee was the one with the problem.
In addition to ketorolac, do you consume any other medication?
At work, I take acetaminophen when I forget the towel. At home, vitamins that my wife bought in those places where they sell all kind of natural things.
Do you have any type of allergy?
No, doctor.
Do you have all your vaccinations and did you take your routine exams?
Of course. Even I always use my seat belt.
Is there a story of disease of interest in your family?
No, my parents are very healthy. My brothers too.
Who are your children in health?
My daughter has asthma, and my son is totally healthy.
Do you drink or smoke?
I am occasional drinking about once a month, and I stopped smoking 5 years ago.
Do you have insurance?
Yes, I do.
Okay. Could you tell me what your religion is? This is necessary to know what to do in case of any type of problem that rising to surgery is necessary. As you know, there are religions that do not allow transfusion of blood there before it's necessary.
Well, I am Catholic.
Thank you, Mr. Moises, for your preparation. Now, please, will you go to the examination bed to continue with the physical exam?
Yes.
Okay. To begin, these days, have you had any change in weight? Have you felt fatigued or tired? Changing your hair, nails?
I have only presented weight gain, and but have been progressive for months.
Okay. Have you present blurred vision, pain, redness, or tears? Do you wear glasses?
No, my vision is excellent, and I don't wear glasses. You know what?
Well, I will check your throat to verify that everything is fine too. Okay.
Yes.
Okay. Could you pull out your tongue? Pull out your tongue. Like and one. Okay. You are excellent. Now I will prefer to check his ear to look for some abnormality, okay? Okay, I'm gonna take your ear. Okay, we're on the right way. It does not present anything abnormal. Have you ever had profuse nasal bleeding that does not stop or trouble breathing?
Now I just ground up the night.
Have you recently seen a dentist?
Yes, last month I went to the dentist to my revision team, and the doctor said everything is in order.
Now, I'm going to ask you to unbutton your shirt a little bit so I can evaluate the hair sounds. Okay? Your heart sounds healthy. Have you ever experienced any kind of problem, claudication, dyspnea at night, or swelling extremities, chest pain?
No, never.
Have you received blood transfusion or any component?
No.
Is it common for you to experience headache?
No.
Have you ever suffered any kind of fainting, epileptic attack, memory loss, anxiety, depression, vertigo?
No, never.
Well, during the day and night, do you have problems urinating? Do you drink enough water? Do you sweat excessively or have any kind of intolerance to when you're in cold or hot climate?
No, doctor. And of course, I drink a lot of water.
Now, I will continue to listen to your lung fills. Okay, can you cough, please? Inhale and exhale. Deeply. Excellent. As you said, you're very healthy. Well, I would like you to ask you about your gastrointestinal tract. Have you percent change in your appetite lately?
Yes, I like to eat more since I become more sedentary.
Okay. Do you have diarrhea, constipation, gases, recurrent nausea, abdominal pain?
I tend to go to the bathroom once a day. I only have gas when I eat food such as beans and violent vegetables. When I have painful episodes in my knee, I get nausea, but I don't know vomit.
Do you consume dairy products?
Yes, kind.
Have you ever had reflux during the nights or after meals, or some type of bleeding either through your mouth or rectum?
No, thanks God, no. I only present reflux when I eat spicy food.
Excellent. Regarding your genitourinary system, have you had problems urinating, whatever you urinate a lot or a little, incontinence?
No.
Okay. How do you consider your sex life?
Well, I have never sexual impotence or any problem of interest. Only the number times I have sex with my wife because of my knee pain when I have sex.
Any sexually transmitted disease that you know?
No.
Have you found any type of normal mass in your genital area?
No, doctor, no.
Everything is fine with you, Mr. and Mrs. So now we will concentrate on your main problems, okay? For that, I need you to perform a couple of tests, first, how to say, and verify what kind of danger is in your knee. Are you agree?
Yes, please.
Good. Could you please lie on your back?
Yes.
Good. First, I will assess the stability of your knee cruciate ligaments due to the high frequency which they are injured in athletic people. If you feel pain, just say that, okay? You didn't feel pain? Stand up, please. That's good. Now we'll assess if there are any damage on the meniscus of your knee. Okay, looking for any meniscal syndrome. Could you please lie on your chest?
Sorry.
Stand up, please. Well, Mr. Moises, excellent. My next step is to check the stability of the collateral ligaments. If you feel any pain, just please let me know.
Okay.
Now, please, Mr. Moises, lay on your. Stand up. As I said, well, you don't have any discomfort in any of the moves. However, I would like to do another one because I may suspect you have arthrosis of your knee. Okay, now please just lay again on your back. I'm gonna take
It hurt.
Yeah.
Oh, I feel pain, Edgar.
Okay, now stand up, please, and let's go back to my desk.
Okay.
As I say, your right knee has a high probability of presenting a degenerative process. Therefore, we must apply a pair of stamps to assess the severity and start treatment as soon as possible. Mr. Moises, listen. Arthrosis of the knee joint, commonly known as wear and tear arthritis, is a condition in which the natural cushioning between joints and cartilage wears away. When this happens, the bones of the joints rub more closely against one another with less of the shock movement and some benefits of a cartilage. The rubbing results in pain, swelling, stiffness, decreased ability to move, and sometimes the formation of bone spurs. That's why I will send you an X-ray and corticosteroid injection so that you can carry out your activities as quickly as possible. I'll see you again in a week. We'll search for a resolution in this problem, so don't worry.
Thank you so much, Doctor. I will see you the next time.
Bye, Mr. Moises.